to this next case. It's a CT scan as well. Okay, so CT outer pelvis, is it contrast or non-contrast? So based on this image, I feel like there's going to be a contrast enhanced study. The reason I say that is because you can look at the vessel over here, and that looks slightly brighter. That looks like the aorta. Aorta is on the left, for those that don't know. And then we just wait for the image to download, but we come from the very, very top first. So first off, we've got the lung bases. Scrolling down, you can see a little bit of kind of stomach poking out there, can't we? So that's going to be a small hiatal hernia. No evidence of ischemia. The stomach actually looks okay from this point of view. We keep going. I'm going to scroll through one so that if anyone can't see, is not scrolling as well, they will be able to have a look themselves and scrolling through. Did anyone see anything wrong? So yeah, someone's come up with something very good there. Very good. Okay, cool. So there's a few things to be looking at. Yeah. I haven't had the word dirty mesentery. Oh yeah. So someone said pink puffer earlier. I just wanted to say I can't remember what pink puffer means. I remember that coming up with like COPD and all that, and something to do, well, their cheeks are red or something. I'm going to look that up. That's really brought back some memories. Anyway, so let's have a look. So yeah, someone said the liver looks a bit fatty. Yeah, that's right. It does look a bit hypodense. And then as you come further down, yeah, the gallbladder looks a little bit hyper enhancing, doesn't it? But actually, when you come around this area, you can see there's a lot of enhancement. I mean, a lot of fat stranding located within this area. And so you got to think, okay, what could be causing that kind of fat stranding, right? So yeah, you can get duodenal ulcer. You know, duodenal ulcers could cause some fat stranding like that. What else could be causing fat stranding? I guess a gallbladder could be causing, but the gallbladder fat looks normal as well. It doesn't look too bad, actually. And then you got to look at the pancreas. So let's have a look at the pancreas. Pancreas goes along like this, and you come to this area over here, and this is where you've got this sort of head of the pancreas. And it's just around there, all looks very, very inflamed. The pancreas itself looks a little bit edematous. So this would be, yeah, exactly like a pancreatitis picture, right? And so when you've got a pancreatitis picture, the rest of the pancreas looks okay, but this area of the pancreas doesn't look normal. And actually, a hyperlipidemia can be a risk factor for pancreatitis, and this person does have a fatty liver. So that is one of the things to be concerned about or thinking about. But complications of pancreatitis can be, look, you've got to think about location now, yeah? You've got a splenic vein, which is sitting right next to the pancreas. You just got to look, does that look like it's blocked off? Because that could be a problem. You got your renal vessels that are not far as well. Could they have a problem? So they actually are okay at the moment. Someone's gone for cancer of the pancreas. Now, again, it does depend on the clinical history of the patient. Has the person turned up with weight loss? Have they turned up with pain? What's the amylase looking like? Of course, those things are possibilities and may need to be looked into later once this person has had been treated for this initial bout of pancreatitis. But this is actually just a straight up pancreatitis, and I thought it was quite good because it can start to make you wonder, like, where is this coming from? Is it coming from the duodenum or anything else? Now, interestingly, this person, if I remember correctly, does have a small renal stone that's not causing any issues, and they've got some calcification located within the SMA, and that can be sometimes worth noting because sometimes you've got someone who's got lots of abdominal pain, you've done your scans, you can't see anything abnormal, but you do see a bit of calcification located within the one of the mesenteric vessels, and then it may be worth doing further investigations by getting a mesenteric angiogram, and that may show that there's a bit of obstruction to flow and that kind of thing. So it's all quite interesting stuff. But this one is actually a CT out of the pelvis, portovenous phase, and the big finding's got pancreatitis, and you've also got this steatosis as well in the background. Good. So GB wall, yeah. So I'm with you, and I initially thought the same thing, but actually it doesn't look like it's inflamed, right? The gallbladder doesn't look particularly inflamed. It looks like it's a bit thin-walled, and it's also got no fat stranding around it. So actually, I do think it may be as a result of the steatosis around it, right? And that can be a little bit misleading. But I don't think I can buy that. That's definitely inflamed. But undoubtedly, the inflammation really is centered around this area over here, if you can see that. Right. So let's